I'm your host.
Went live.
I'm your hostess, Nurse Alice, and we have a wonderful discussion planned for you today. So I will be facilitating the conversation, but then I also have a wonderful list of panels that will be joining me. So to begin with, I have Amy Serrano, who is a 29-year-old New Yorker who is using her personal battle with sickle cell anemia as a platform to educate her community. She realized that not many people knew about sickle cell and what impacts. So in 2013, she launched her very own campaign called Who Knew? So by using social media, she shows her everyday struggles with sickle cell anemia and hopes to dispel myths of the disease and people living with it.
Hello.
Also, thank you for joining us. Also on panel, we have Dr. Raquel Shelton, who's an assistant professor of medicine at the University of Alabama, Birmingham, the Bone Marrow Transplant and Cell Therapy Program. So she has a lot of wisdom that she's going to impart on us. And last but not least, Dr. Renee Matthews, a regular BlackDoctor.org contributor who has appeared on several television shows, from The Oprah Winfrey Show, Roland Martin's News One Now, and WGN-TV's People to People, where she discussed different health topics. She's also been a writer for Ebony Magazine, Good Enough Mother, and as well as BlackDoctor.org, where she addresses health topics such as asthma, health and wellness, and a slew of other things. So ladies, thank you so much for taking the time to join us and help dispel, the myth and the confusion around sickle cell. So if it's okay with you, Amy, I'd like to, start with you. You're someone who's personally going through sickle cell disease. Tell us a little bit about your story. I mean, does anyone else in your family carry sickle cell? How did you find out? Tell us about those early moments when you learned that you had sickle cell, and what did you do?
Okay, I'm a fraternal twin, first of all, and my twin does not have sickle cell, but I have an older brother who has the trait. And I didn't really fully understand what I had until I was about in junior high school, when I was always missing school and in the hospital, and I had teachers teaching me inside the hospital, and I was always confused, like, what's going on? My mom never really explained to me what I had. She just said, you don't feel good. She was like, I can see you in pain, and I would feel my body in pain, but I didn't know what was going on. And as I got older, like towards the 8th grade, I decided to she told me one day, like, oh, you have something called sickle cell. The doctor said that, it destroys your blood cells. So I was like, okay, mommy, so I don't be feeling good sometimes, so that's what it is. She was like, okay. Then I just thought every day, okay, live day by day, but then there would be periods of time I'm not in school. Until I really got into like junior high school, I decided to do my own research and was like, what is sickle cell? And I didn't accept what I had until I was about 20 years old. Because I always questioned God, like, why me? Why do I have this? Why don't my twin have it? Why does no one else in the family have it?
Wow, so you were very young when you learned that you had sickle cell, and as you just said here, it took up to the age of 20 to really fully understand and actually embrace it.
Yes.
Wow. So, Dr. Shelton, if you can tell us a little bit more about, what is, because Amy just spoke about sickle cell trait and sickle cell disease. Can you help us to understand what is it? What's the difference?
Yeah. So sickle cell disease happens because there is an abnormality in your hemoglobin. And the reason why this occurs is actually a genetic abnormality. So there's a mistake that occurs in genes that make hemoglobin, which is a protein that lives inside of your red blood cell that carries oxygen through your tissue. And so when hemoglobin is malformed because of a disrupted gene, when it gets to areas where the blood vessels are very tight or in very closed corners or low oxygen settings, regular red blood cells with healthy hemoglobin just bend and go through the small blood vessels, whereas sickle blood vessels don't bend really well. When they get in closed corners or low oxygen settings, they almost crystallize in a way. So if you have red blood cells that crystallize in closed corners, they tend to bunch up and get sticky and impede the blood flow to that particular organ. So that is what happens when patients go through um, what's known as a pain crisis. It's really low oxygen getting to that particular tissue because the sickled cells are bunched up and blood can't flow through to supply healthy nutrients and oxygen to the area. So when that happens, that actually hurts. So that can happen all over your body. It can happen in your brain. It can cause strokes. There's some sickle cell patients that get diagnosed at a very young age, as young as 3 or 4, because they actually had a stroke. So this disease, we don't know why this genetic event happened. It's actually historical. And there's some significance with our ancestry if we trace it back to Africa. And somehow it's found that patients that had the sickle cell trait, just one of the abnormal genes, actually had an advantage in areas that were endemic of malaria. The malaria that caused death wasn't able to penetrate the red blood cells as well, so they actually had a survival advantage.
Wow.
That advantage happens if you just have the trait, but if you have a child with another person who has the trait and you inherit 2 genes, that means you actually have too much sickle hemoglobin, and that is what causes these crises.
Wow, that's I can say it's wow, because the way you describe that helps me to understand. So if I could just kind of recap, it sounds like our blood cells are shaped a little bit differently, and as they travel through our body, there's lots of bends and curves, and if any, and they're very small blood vessels, so if those abnormally shaped blood cells kind of clump up, it can cause a lack of oxygen and nutrients to a particular area, which can cause damage and cause the pain. Is that kind of what I'm hearing? Is that the general gist of it?
That is correct.
Okay. And I've taken care of patients with sickle cell, and maybe I didn't fully understand the complete details of what's going on in the body. Dr. Renee, I know you've seen patients with sickle cell, but even before we get to the crisis, Dr. Renee, how does someone find out that they have sickle cell or sickle cell traits?
So most people in prenatal care, the mothers are tested, and that's when they find out if they have the trait, and then subsequently, if they have the trait, then they'll find out. The OBGYN will then test the partner to see if they have the trait, and then let them know that there is a high probability of their child having sickle cell, and then they would test the child for sickle cell disease. It is now, of course, moms always have an option to say no to some of this testing, which is how you end up with people who have children and had for years didn't know that their child had sickle cell.
Okay. So would one of the take-home messages be, if you are someone who does have sickle cell trait, before you get pregnant, as we should be preventative with our care, go and get tested to see if you may have sickle cell trait, and have your partner find out. That way you can plan ahead versus having to then, learn this afterwards. Is that what you would recommend to your patients?
I would highly recommend that, as well as if you are pregnant and you're going to the OBGYN, make sure that you ask, because if you don't know your family history, then it's important to ask the OBGYN to please make sure that they test you for that. Just in case that your doctor wasn't going to test you or something, make sure you find out. And actually, if you donate blood, they do, in the donation of blood, they test, and they'll let you know as well during that.
Okay, so that was going to lead into my next question. We were talking about getting tested for sickle cell trait, but my question was going to be, how does one get tested? So is it as simple as a blood draw?
Yes.
Okay. And now, is that something where I can just kind of do a finger stick, or is that an actual, a blood draw from your vein? I'm just kind of curious for people who are watching, because some people are afraid to get tested. So the more that they know, they can, anticipate these things. So they can just go to their provider and say, I want to be tested for sickle cell trait, and anticipate a blood draw through a small vein of theirs.
I'll defer that to Dr. Shelton, because I don't treat patients. So.
Okay. So, Dr. Shelton, so it sounds like sickle cell can be very devastating, but knowing is half the battle, and we can know that with a simple blood test. Is that correct?
Yeah, it is a simple blood test. Whether or not you can get enough blood out of a pinprick, I'm not exactly sure. A
Okay.
pinprick definitely can tell you whether or not you're anemic. But you may need a little bit more blood. I just absolutely don't know. The test is a simple test, even if it is just a simple blood draw. And there's a particular pattern that healthy hemoglobin has when you put it on a specialized plate. It
Hmm.
migrates at a certain rate. And what they can tell is that if there's an abnormal migration pattern that's indicative of sickle cell, then that's pretty much the diagnosis.
Okay. Is
So,
there anything? Is there anything else that might clue me in to I might have sickle cell? I mean, outside of the blood draw, does someone with sickle cell look a certain way, act a certain way, or present? Are there any physical traits to the disease process that might clue me in, or is it
most
strictly
patients
blood work?
Most patients with sickle cell trait may never know it because usually patients with sickle cell trait never have a crisis. They can if they're in extreme conditions, like if they go try to climb Mount Everest or something where the oxygen is low, that is
Mm,
possible. But with sickle cell disease, the disease usually manifests itself in childhood. And
Okay.
so it's uncommon for someone to get all the way to adulthood and never had known that they had sickle cell disease. But they may be like our guest speaker here, where you were sick a lot as a child, and patients after they get to a certain age, you may have chronically yellow eyes because when the cells bunch up inside of the red blood cells, they actually break. And when red blood cells break, they release hemoglobin and something called
got it.
bilirubin, and that can
Okay.
make your eyes chronically yellow. And so
Okay.
that may be the look of a sickle cell patient, but the key thing is the pain crises, feeling bad, infections. Young men may have erections that last too long and can be very painful. So these are just some of the chronic symptoms that can
Okay.
come along with having this disease chronically.
Okay. So, Amy, so I mean, we've heard from our doctors talk about some of the um, some of the things that patients can present with. I'm just curious to know, now that you're in your adulthood, how does sickle cell anemia impact your daily life now?
Now it's more so worse. When I was young, I can't be so active. Um, I used to work. I was a dance instructor because I love to dance, and that kind of had an impact in my life too because my hips are bad, so I'm supposed to have a hip replacement surgery next year. So it hurts for me to walk for a long period of time. Um, Being too active, like I can't do too much. And as much as I love to party, swim, and dance, it's like my body knows like you can't take it. And I would constantly have to take pain meds or just relax or sit down. And it kind of sucks because you see everyone in their late 20s turning up, partying, and it's just like you can't do it. And then if you do it, you have a consequence of being in the hospital the next day or being in pain constantly. So I just have to live a slow lifestyle. But then I don't let sickle cell stop me because I still live life. I still go on vacation. I still do what I can do, but I don't do it to the extreme.
But you still live life, and I'm so glad that you said that, because we don't want our viewers feeling that sickle cell is a death sentence, and that everything falls to pieces. I mean, looking at yourself, you said you like to dance, you could swim, you still live life, and I think that's one of the important pieces. And once after we've identified that someone has sickle cell, it's really about management, and the things that we can do to stay healthy. And we are going to get into those pieces, but I wanted to ask something else, because you actually started a campaign,
Yes.
because you felt like people didn't know enough about sickle cell. So tell us a little bit about why you started the campaign, and what are some of those common myths that you were hoping to dispel?
Okay, the reason why I started this campaign is because I was tired of being quiet. And my twin has full-blown HIV, and I saw how he accepted his situation and become an activist and a spokesperson for it. So I'm like, wow, that was encouraging. So like I said, I didn't accept my situation until I was 20. So for a long time, I was just thinking, what can I do to have people listen to my stories besides the sob stories of I'm always in the hospital, I'm always sick. So I'm like, no, I'm gonna show people the other side of people living with sickle cell. Like I turn up, I party, I go to school, I go to work. And my campaign, Who Knew, is basically saying who knew. Like they look at me and I'd be like, yes, I have sickle cell. Someone would be like, I didn't know that. Oh, that's that thing T-Boss have. Oh, that's that thing Prodigy have. And I'm like, see, that's the only thing people know about sickle cell. That one celebrity have it, but they don't understand what is sickle cell. And it's just like, don't sympathize with me. Understand what I'm going through. So Who Knew was all about breaking a statistic. Like people with sickle cell are malnourished, that we're skinny, and that um, we are drug seekers, and that we look sick, that we look tired, we look hurt, that we're constantly looking like something. And it's just like, no, I'm beautiful. I beat my face to the gods every day. I feel pretty. I
I
don't feel
love it.
ugly.
I love it. You are beautiful. You're very beautiful. So if
Thank
people want to
you.
find out more about your campaign or be a part of it, how can they find out more about it?
I have Facebook. It's facebook.com/Amy Who Knew, and you can also follow my Instagram at I.me.who knew. And it's just basically showing these events that will attract people's attention. So Who Knew, we do events in like social clubs, or I did a event called Paint for Sickle Cell, just to grab the attention of what society likes to do, because fashion's in, after work is in, going out to paint night is in. So I host these events and to talk about sickle cell, but also have a social gathering at the same time. Because, like I said, the story gets boring after a while of, yeah, I'm sick in the hospital, I need blood, or I'm constantly in pain. It's just like, no, we're going to have a nice time. We're going to enjoy each other's company. Then let me speak about sickle cell and back to having a nice time.
Right. I love it. I love it. I'm going to actually go and join and look at your Facebook as well. So Who Knew? Wonderful. Now, so we've talked about, a little bit of background on who's at risk for sickle cell. We've talked about, what happens in the body, and you've shared your personal story about how you're managing and dealing with it. Now, is there a cure for sickle cell? So one of the doctors, if one of y'all ladies could please take this question. Once I've been told that I have a sickle cell trait, or I have a child who has sickle cell, is there a medication, a treatment, a way to, to get rid of sickle cell, or what? I mean, if you could just talk to us about that, the treatment options with sickle cell.
So I was an educator actually for the umbilical cord blood bank, and umbilical cord blood stem cell transplants are available to sickle cell patients. The caveat, of course, is that you would have to have treatments to completely suppress your immune system, and so you get ready for the transplant, which a lot of people do not want to do. But that is a treatment that is available.
Okay. Is it a painful treatment, Dr. Renee? Is that the treatment that you described? Is it painful?
It's just like a bone marrow transplant. It's the same thing. It's just that it's coming from the umbilical cord blood. So for the receiver, it's painful because of the process. The chemotherapy they have to go through to get ready for the transplant. Mm-hmm. I would think that is probably the most painful process for them. Otherwise, for them, it's just just like they have to have most sickle cell patients have to have blood transfusion at some time in their life. So it's very similar to that.
Okay, thank you for explaining that. And Dr. Shelton, you were going to add to that?
Yeah, the majority of patients now are managed with medicines to try to keep their blood from sickling. So hydration and some medicines that help you to make a more primitive form of hemoglobin that holds on to oxygen a little bit better and give you the vitamins that you need to make red blood cells. Stem cell transplant is curative for sickle cell anemia, and it's over 90% effective. The issue really is trying to pick the right patient for a stem cell transplant, because it comes with a host of potential complications. There are multiple sources that you can get stem cells from to donate. Essentially, what we try to do is get rid of your early stem cells that make sickled red blood cells and replace them with healthy red blood cells, or red blood cell what we call precursors or early red blood cells. And once that occurs, it doesn't have to be a complete takeover, but even just getting a good amount of healthy red blood cells made almost dilutes any sickle cells that are left behind, and a person can essentially be cured. Cord blood used to be used a lot more. It's kind of falling out of favor a little bit over the last few years, and we more likely use adult humans. Patients with sickle cell disease, the safest type of transplant is if you can get a stem cell transplant from a brother or sister. But in families, you may only have the way that we match stem cells. You'd have to match more than just red blood cells. You have to match white blood cells as well. And that's a genetic matching, and that only occurs in 25% of patients will have a family member that matches them genetically enough that you can tolerate all of their blood cells in your body. So that leaves patients to unrelated donor transplant. And unfortunately, since the majority of patients that have sickle cell disease are African American in this country, the donor registries are don't have many African Americans in the registry. So there's about 9 million people in the registry, and only about 7% of those are African Americans. So there's a low percentage of donor possibilities, which leaves the sickle cell patients with not very many options of who could donate to them. But we're now looking at half-match transplants. So that, most people have, mom and dad that can be a half-match transplant for them, or even a brother or sister can be a 50% match. So we're currently investigating ways to make that safer, and then transplants will be offered to more individuals if we can make it safer, because there are some people that have sickle cell disease and they have mild sickle cell disease. Some people have moderately severe, and then there's the extremes. So people who only have very mild symptoms, they wouldn't trade that for going through a stem cell transplant that has a lot of other potential complications. But someone who has severe sickle cell disease, for example, a stem cell transplant would be very attractive and much better than living with severe sickle cell.
So this is good information. So for those of you who may just be tuning in, you are joining us for the BlackDoctor.org sickle cell panel. With our guests, we have Amy Serrano, Dr. Shelton, and we have Dr. Renee, and we've been having such a fruitful conversation. And Dr. Shelton was just discussing with us some of the treatment plans and options for people with sickle cell. Now, I want to ask this question because you've referenced a small donor pool, and anyone can chime in here. How can we increase that donor pool? What's the message that we need to get out to the community? Is it that we need to donate more blood, or are there certain people that need to donate blood? How can we
need more people on the registry that look like us. That's the bottom line. We need more people to register to be bone marrow transplant donors, and then more pregnant women to donate their baby's cord blood. We need more people to actually, in the registry, it's not even a blood draw, it's a cheek swab to get onto the registry.
Well, how does someone find out about this? Because I'm just thinking in the back of my mind when I go to my annual appointments, I'm not asked. I mean, prior to this conversation, I didn't know how small the donor pool was. So now the next time, is this something where I can go to my primary care provider and say, hey, I'd like to join the registry, or is there somewhere that I should go to actually do these things?
You can go to BeTheMatch.org. So if you remember Be The Match, and there's you just click a button on how to be a donor, and someone will contact you and get you the materials you need to be able to send in a sample. And I think that the main thing that needs to happen is to raise awareness within our own community. I mean, most everyone is aware of sickle cell disease, and I think that it has to be kind of a change of a mindset. We do stem cell transplants for a lot of different type of blood disorders, and the people who tend to donate to registries, seem to have kind of a altruistic kind of look on life, like a sense of civic duty to kind of give to their fellow man, and they'll do it no matter what. And so I think that if we can promote that kind of sense of spirit amongst ourselves, that we need to take care of each other and people that look like us, then then maybe we'd be able to get a little bit more energy toward helping others with this disorder, and also demystifying bone marrow transplant. I mean, it sounds like it's something that's very painful, that it hurts. Oh my gosh, they're going to dig in my bones and I've got to go to the operating room. And we're a lot more sophisticated now than we used to be 20 years ago doing bone marrow transplants. I mean, if you want to know what the actual procedure looks like, you get 4 days of an injection that with a very tiny needle that looks like, if you've ever seen anybody give themselves insulin, that's as big as the needle is, and it's just under the skin. It stimulates the stem cells to come out of the bone marrow space and float around in the bloodstream, and then we give you an IV line and take the stem cells out. And that's it, and you're done. And it's like, it takes 5 days. It's like 4 days of just shots and then 1 or 2 days on the machine, and then that's all. But I think that the whole, because it's like this big unknown, it strikes fear for just an average patient to even think about the possibility of donating, unless it's something that's really near or dear to the heart. You know, people will do it if there's a family member involved. But
Right.
stretch and take the time to do that for an unknown person takes a little bit more effort. And so
I think so.
I think that if we really promote that, I guess we're all family in a way, brothers and sisters, and we're really the best people to help each other, then that's a slow change of a mindset that needs to occur.
So I want to say this, and so thank you for saying that. And I'm just, as we were talking about, raising awareness about sickle cell, what is it, what happens to the body, and how can we treat it, but also encouraging people to be in the pool as a resource. In our communities, some of us have a hard time as it is already just trying to get to the doctor for ourselves. So I think when we are just afraid to get our own blood pressure checked, our own lab values checked, it's hard to see beyond, over that fence to try to help someone else. But, if one day it's going to be you. I think, not saying that everybody needs a blood transfusion, but you never know in life. Something's going to happen. And, thank God that there's someone who maybe donated blood or donated an organ or donated something to help you. And I think we need to change the mindset, as you were saying, to think like that. But
I
Dr.
always
Nay, I saw
tell
you shaking.
people, yeah, I always tell people that that you should. My whole philosophy is that I could maybe help someone, and because I'm trying to help someone, God forbid I need help, the help might be there for me.
Yes.
And so that's the philosophy I take. I am a registrant, and I'm on the registry. And then also, when I do have children, I'll donate the cord blood as well. So I know that it'll be out there. Whatever, what I mean, whatever it is, it will be out there. And if, God forbid, somebody needs it, then it's there. Then I will be more than happy to donate. And then if I need it, hopefully the same will come back to me. So,
absolutely.
With so many of us coming down with cancer nowadays, it is really important that, that we do have these options available to us. Because like Dr. Shelton said, the percentage, 7%, when you think about that, that's so extremely low. Yeah.
Yeah. Now, Amy, do you know, I mean, you're kind of in that 20s demographics. Do you think that age plays a factor in whether people want to be a part of the registry or donate? Or, I mean, for someone in your demographics, do you think that we can encourage people to be a part of the registry?
Yes, we can encourage people. Like I said, I always mention Delete Blood Cancer Cell Organization when I have any of my events. I have some of their panels in my gift bags just so people can be informative, because people always ask, is there a cure for sickle cell? And I do mention the bone marrow transplant information, and I give it more in depth. And I also tell people to donate blood, to research more, and because it don't hit no one until it hits home. Like doctor said, like once it hits home, that's when everyone wants to be involved. And I feel like if we constantly repeat it, make it a trending topic, or always hashtag it, we would definitely get the attention that we need, from where it's either to be a registrator or to donate blood, anything, or get informative, until it becomes a real big topic, we don't get noticed.
Right. And so for any of our viewers out there, if you are interested in becoming a registrant or donating, please visit www.deletebloodcancer.org/register to become a potential bone marrow. I mean, as the doctors were saying, we have such a low pool of registrants. We really could use everyone's help with this. And, we shouldn't have to wait till it hits home. I liked Dr. Renee's philosophy about, helping someone else, and, with the mindset that hopefully when she needs something, someone else will help her. And again, for those of you who are tuning in, you are tuned into the BlackDoctor.org's panel discussion for sickle cell with our wonderful panelists. We have Amy Serrano, someone who herself has sickle cell disease. We have Dr. Shelton, and we also have Dr. Renee, who are experts in this topic and sharing their knowledge with us. So we've been having a fruitful conversation here. So as we kind of maybe begin to wrap things up, I'd like to go to each of the panelists and maybe ask, for what would be your take-home message to someone out there who maybe doesn't know they have sickle cell, or doesn't really know much about it? How can they get involved, or what would you recommend they do to get involved or to learn more? So Amy, I'll start with you, since you have this wonderful campaign. I'm sure you're going to share it. Tell us about it again, right?
Yes. I would say people get involved with Who Knew. Just come to any of my events that I have. You can follow my Instagram at i.me.whoknew, or follow me on Facebook, facebook.com/AmyWhoKnew, and just become to these events and get knowledge and become more educated on this topic, on sickle cell, on bone marrow transplants, on donating blood, and be a leader. Because when it comes to these type of topics, it's taboo in our community. And once we become a leader or a voice and have some type of followers, people's gonna notice us. And that's what my campaign was about. Because I started off with no followers, and I just started talking, and I became a topic, and people started looking into me and started looking into Who Knew. And you never know who you have the voice for. You can be a voice for someone else. You can encourage other people to step forward or look forward into anything, or to doing anything positive towards this topic.
I want to commend Amy on really taking her own personal story and being a champion with sickle cell. We need more people like you out there, and I'm definitely going to follow you on your social media. So Who Knew? So if you're not following them, please follow them now. Okay, Dr. Renee, what would you say? And then tell us how we can get a hold of you as well.
So my takeaway is that sickle cell patients are not drug seekers. So caretakers, it's very important for all the healthcare professionals to realize that these people are in serious pain. And then we as a community can help, because we can register on the bone marrow registry. Anybody who's over 18 can register on the bone marrow registry. Like I said, it's just a cheek swab. So if you email deletebloodcancer.org/register, and I'm sure they'll mail you the materials, you just mail it right back, and then you're on the registry. And it's really that simple. So the more people we can get registered, the more chances we have of helping each other. And you can reach me at Ask Dr. Renee on all social media platforms. So that's Twitter, Facebook, Pinterest, Instagram, Blab, Periscope, and YouTube.
Wow. And thank you for that message. So I will be honest and say I'm not registered, but after today I will be registering. So I will be going to deletebloodcancer.org/register to get more information about it, so I can register myself. And so last but not least, Dr. Shelton, your parting words of wisdom for our lovely audience today.
Yes, and I'm sorry that Delete Blood Cancer has a site that you can go to, as you pointed out, to find out how to register. And, this organization has really taken on promoting awareness for sickle cell disease. So I would say that this is a good starting point for anyone who wants to know more about what's going on. I mean, they've championed this effort. This is more than we had a Twitter session a few weeks ago, and so this is something that is important to actually delete. And so this is a good starting place to look. Also, ambitious young patients like Amy who started their own sites, who are willing to put themselves out there and tell their story. You have no idea how many lives you may touch of people who are invisible, who don't have um, the ability to be as effective as you are. And so keep doing what you're doing. I encourage people to look on the internet and look for people to reach out to in your particular area. You can go to the CDC website. They also have helpful advice. Just outreach and know that you're definitely not alone. I mean, 1 in 12 African American births have sickle cell trait in this country. So there are a lot of people out there that know but maybe not talk about it. One of my patients actually gave me a good piece of advice once that I'll share with you and delete in talking about who would be the best people to target to try to increase the donor pool to help you and other patients. And really, the young people would be the most likely people to have the type of mindset that we alluded to earlier, in sense of social justice. Going to college campuses, those sorts of things usually turn out really well, and young patients are willing to help, even people that they don't know. So that would be a good place to target, and just keep on doing what you're doing, keep on raising awareness, and keep on raising your voice.
Fabulous. Thank you so much for sharing that. And again, I want people to please make sure you visit the website, deletebloodcancer.org/register. And you can also follow them on Twitter. And there is a hashtag. So if you want to look for more information on sickle cell or maybe insert your own message about it, do hashtag get swabbed. Okay, so for all my social media folks, that's again hashtag get swabbed. Now, I've had a pleasure, and the conversations are never long enough. I just have to say that. It's been my pleasure to facilitate today's conversation. I'm Nurse Alice, and you can find me on social media as well at Ask Nurse Alice, and a website. Do have a website, alicebenjamin.com, and you'll find tons of things that I'm doing, great conversations like this, other articles, health articles related to similar health topics. And then I also, again, want to thank Delete, BlackDoctor.org, as well as BlackDoctor.org for, being the sponsors behind today's Google Hangout. Very thankful for them. So please make sure you go to the website at BlackDoctor.org. They also do have Twitter, Facebook, Instagram. Please follow them so you can, and visit their YouTube page so you can see this recording and other recordings on other similar topics, and then just stay in tune with all of the health things that are going on. They provide us our daily life of medicine. So that's it for today, and I want to thank everyone for watching. Till next time.
Thank you.
Thank you.